A person who has amputated a limb feels the presence of the limb that should have been lost, which is called phantom limb. These amputees often feel pain at their phantom limb. This pain is called phantom limb pain. The mechanism of PLP has not been elucidated medically yet, but past studies have suggested several hypotheses of PLP. One of the hypotheses is that PLP occurs because of dissociation between sensory prediction and actual movement when a signal to move the amputated limb is sent from the brain. Conversely, it can be thought that pain may be reduced if the patient can get a sense of moving the phantom limb when a signal is sent from the brain. Based on this hypothesis, some systems to alleviate PLP have been developed, for example, mirror therapy, AR or VR therapy, and so on. However, there is a serious problem of PLP treatment. The problem is insufficient number of therapists. In treating PLP, the therapist's support is important, and phantom limb pain patients are scattered in various places. But, because of limited number of therapists, it is difficult for them to stay around. So, the therapists are required to visit the patients or patients are required to visit the therapists. Sometimes they are forced to travel long distances, which make them struggle. To solve this problem, it is necessary to realize a remote treatment system that enables therapists to provide treatment to patients from remote locations. Therefore, we proposed a VR remote treatment system of PLP in which a therapist can treat a patient from a remote place. This is our system configuration. The user's whole body movements is measured by the Azure Connect, and the movement of the hands and fingers of the normal limb is measured by leap motion. The movement of the phantom limb is generated by inverting the measured movement of the normal limb from side to side, and the avatar is operated by using these data. The avatar is displayed in a VR space and observed by using HMD. This is the view that users can watch during using our system. As you can see, the avatar's both hands are moving even though the user is moving only one hand. This is a picture of two users using our system. You can see that the movement can be transmitted in the real world. In our system, users can change the positional relationship between the therapist's avatar and the patient's avatar by operating controller of HMD. This is initial position. Therapist and patient are facing with each other a little away. This is second position. Therapist is close to patient keeping facing. This is third position. Therapist is overlapping with patient. The length of the phantom limb felt by the patient change as time passes. This phenomenon is called telescoping. To cope with telescoping, our system has a function of adjusting the length of the upper limb of the patient's avatar. This is a movie that a patient is changing the length of his avatar's upper limb. To change the length of phantom limb, patients operate GUI in the VR space. This is the appearance of adjusted avatar. This is a movie that a patient is. We conducted a user study to evaluate how our system influence on the ease of treatment. Participants are as follows. In this user study, first, patients do 3 tasks in 3 conditions according to the therapist's instructions. Then each patient and therapist answer questionnaire after each condition. Finally, after they complete the questionnaires on all conditions, we interviewed each patient and therapist based on their questionnaire results. 3 conditions are as follows. In the first condition, only the patient is in VR space and therapist instruct them only by voice. And in the second condition, both therapist and patient are in VR space and facing each other. In the third condition, both therapist and patient are in VR space and overlapping. 3 tasks is as follows: erecting hand, repeating hand supination and pronation, and drawing figure 8 with palm. This is the patient's result of questionnaire. We asked subjects 4 questions, and they gave each question a score from 1 to 7. The right figure shows the average score of each subject. And this is the therapist's result of questionnaire. We've got many opinions in our interviews, but here I focus on certain aspects. From the viewpoint of ease of understanding therapist's instructions, the following comments were obtained. Many positive opinions have been obtained for the proposed method. From the viewpoint of ease of getting patients move as intended, the following comments were obtained. Both therapists state that it is easier to give instructions if they are in VR space than only voice. Finally, I will conclude my presentation. We proposed the remote treatment system of phantom limb pain in which the therapist can give instructions to the patient with amputation on one side by presenting not only voice information but also body movement in shared VR space. Our proposed system has several advantages as below: adjusting telescoping, changing positional relationship, and instructing by using body movement remotely. And we conducted a user study and we can get some comments show that our system can make movement transmission more smoothly than previous system.